Collecting samples of wastewater may seem like a dirty job, but somebody has to do it so that Dr. Marc Johnson's lab at the University of Missouri can track the spread of COVID-19 and its variants in the state. All he needs is human waste to identify genetic material from the virus.
As long as you're using a toilet, then your waste is going to the wastewater treatment facility, and so we can measure it.
The MU professor of molecular microbiology and immunology is a pioneer in this new science of COVID-19 tracking.
I have the best sort of observation view of anyone in this country. When I see something new, it's very recent, and it's not just like one patient. It's like, okay, in the sewer shed, we're starting to see this thing. I mean, I could tell Delta was the real deal long before the CDC decided it was the real deal.
Johnson didn't dive into wastewater testing overly optimistic. He considered himself a skeptic.
There was a lot of skepticism among a lot of people, including myself, about whether this would really work. Initially, I didn't think it would, but it did. SARS-CoV-2 is what's called an envelope virus. I've been telling my virology classes for 20 years that you don't get foodborne envelope viruses because they can't survive the stomach. So I'm like, what do you want me to detect? There won't be anything left. What we didn't know then, or at least I didn't know, is that supposedly about 50% of SARS-CoV-2 patients get a secondary infection in their GI tract. We didn't have to know anything about what was going on the ground. We could take the wastewater samples and we could tell them, you have got an increase of cases this week. And sometimes we would even know it a few days before they would.
Partnering with the Missouri Department of Health and Senior Services and the Missouri Department of Natural Resources, Johnson's lab was first to identify the Delta variant in Missouri nearly a month before the first patient tested positive for it.
First time we spotted it was in the sampling from May 10th. And it was noticeable because it wasn't just like sometimes when a new variant enters sewer shed, it will start off small and maybe grow. But it was already a good chunk of the sewer shed the very first time we saw it, which was from Branson, Missouri. And at that point in time, just to be clear, it wasn't the Delta variant then. It wasn't coined, the term Delta variant wasn't coined until 3 weeks later. And it was not a variant of concern based on the CDC. It was not labeled a variant of concern until over a month later. But the World Health Organization had flagged it as being the most contagious form of the India variant. So I had been watching for it, and it definitely got my attention.
By testing wastewater from communities throughout Missouri, the lab then successfully tracked the spread of the Delta variant across the state. It's called the Sewer Shed Surveillance Project, and it has a website with a tracking tool for anyone to follow. Just one positive case in a community can be identified in wastewater. One case among at least 1,000 people.
That is my estimate, is we could detect 1 in 1,000 to 1 in 10,000. That is probably our range. Basing it sort of on knowing where we've gotten signal and, kind of what the caseload has been.
Missouri is the first to have this level of success with wastewater surveillance. Johnson says that's because his viral sequencing protocol is different.
No one else is deciding to use our protocol, but I know that they're all still struggling with theirs. No one else is saying, oh, let's do it the way Missouri's doing it. They're all continuing to try and get the whole genome every time.
And the way Johnson is doing it quickly identifies variants.
We developed the techniques where what we do is we look at a very small piece of the SARS-CoV-2 genome. So it's kind of like, if you can't look at the whole person, but you want to be able to tell who they are, you would probably look at their face. It's kind of like that.
Johnson is confident he'll be the first to know when and where a new variant may emerge in Missouri. The new mu variant is a variant of interest. He's already identified the presence of mu in a handful of samples over summer months, but nothing alarming.
We're watching for it. I haven't seen anything scary new yet. Delta is sort of like still the cream of the crop. It is really contagious.